I guess that comes down as what you said about the ego, which no one really talks about, the ego of the surgeon. The ego has got to be subdued. You can't have no ego as a surgeon, because there is some ego as being like being a good surgeon or being a confident surgeon.
Yeah.
You've got to have some level of ego. And I think there's too much ego, which we used to see as young surgeons or registrars, but all our consultants, like 90% had. They couldn't be approached, you couldn't speak to them, they talk down to people. Then the complication was never, ever their fault. And it was always a patient's fault.
Yeah.
And you get trained like that, that becomes part of your legacy. And then it was years later, it was like, well, you can't blame patients. And I think cosmetic surgery or plastic surgery is the best specialty that the ego gets unraveled, because an unhappy patient can cause so much grief to your practice and to your life. So you very quickly have to adapt to say, okay, maybe I overpromised. Maybe there were red flags all over the shop and I just missed them.
Yeah.
And I am going to learn from this. And this is what I tell my registrars: learn from your mistakes is the best advice I can tell you.